10 o'clock hour, so that means it's time for our lab. So happy Friday. Really excited to be with you all again today. We are officially, 1 week away from the start of spring break, so let the countdown begin. And it does feel like spring. Although the sad news is it's going to feel like winter on Monday, but we will be in spring soon for sure. But enjoy what should be a lovely day after lab and a lovely weekend. So all that is good news. We are so fortunate today to have a guest speaker. Angel Bourdon is here from the South Carolina Hospital Association. She is a longtime friend and colleague, and I'm excited to get to reconnect with her. And to have her here this morning. As you all know, I'm flying solo today. Both Dr. Weiss and Dr. Merrill are out, and Mr. Duggar is out. And so you are left with me. But the good news is that I have a wonderful presenter for you today, and I know that you will enjoy hearing from her. I'm going to give you a little bit about her bio. And then allow her to tell her real story so that you can get to know her, and then she will be presenting about her work as well. Before I do that, I do want to acknowledge and thank Grant Jackson for being back with us today. You're going to get an honorary A in this class just for showing up every time. Thank you for recording the lecture for us and for the benefit of those in the online section of this course. So, Ms. Bourdon is the Director of Community Health and Innovation for the South Carolina Hospital Association. That sounds like a very fancy title, Director of Community Health and Innovation.
They made it up.
There is just a lot involved in that. Through her role, she supports both the member hospitals of the association, but also community partners in advancing both community and population health. But she also provides technical assistance to two significant grants through the Duke Endowment, the Healthy People, Healthy Carolinas initiative, as well as Access Health. And you're going to be learning a lot about both of those today because we have the resident expert and leader of those initiatives. Prior to her current role, she spent 7 years working with Prisma Health. Of course, it wasn't called Prisma then, it was Palmetto Health, but what we now know is Prisma Health System here in the Midlands, where she was the manager of community programs, and through that role did a lot of work around community needs assessments and action plans, and so a lot of the things that you learned about last fall in terms of assessing community needs, the things that Ms. Bourdon did in reality. So she has a lot of wit and wisdom and a wealth of knowledge to share with us. She's going to talk more about her journey, but I will say that she has a BA in communications, right, from Columbia College, and then an MA in healthcare administration from MUSC. So she knows what of she speaks today, and anyone named Angel has to be an amazing person, and she is indeed an amazing person. I'm so glad to have you here today. I'm glad that Dr. Weiss had the wisdom to think about including you as a presenter in our class. And I know she's sorry that she can't be here today, but I'm excited that I get to meet you. So welcome to our class, and please give Ms. Bourdon a welcoming round of applause. Before she even utters her first word. The floor is yours.
Thank you so much. I really appreciate the warm welcome. It's always awkward when bios are read, right? Because I go to work every day to do a good job and make a difference, and ultimately that's why we do what we do. We're called to make the world a better place. So thank you so much for sharing those kind words. I am a firm believer in conversation. So I'm going to spend this time to tell you about what I do. But ultimately, if you have questions, I'm going to ask you questions. I want this to be engaging, not just a session with a talking head up here telling you about my experiences. Does that sound like a plan, everybody? Good thumbs up, yes. Okay, wonderful. So first, career pathway. Dr. Weiss and Dr. Pearson both asked me to spend a little bit of time talking to you about my background and some of the experiences that I've had. So you've heard a little bit about the titles and the work, but I'm going to tell you a little bit about how I got there. I'm a firm believer when it comes to your career to make choices that you're passionate about. do work that matters to you, identify what your skills and your strengths and your passions are, and really lean into those when it comes to deciding where you move next in your career. So in terms of my degrees, we talked about that. I went to Columbia College. I originally majored in business, and you guys who are public health master's majors, y'all will appreciate this. I started in business, and then I started taking financial classes, and like my head exploded, and I said, this is what I want to do with the rest of my life? And I was like, no, not really. But then I started taking some communications classes, again, organic, identifying where my passions were. And in those communications classes, I love learning about the theory, the concepts, having conversations about the communication. It wasn't just going into public relations, which is what I thought when I first heard about a communications major. And so I said, well, let's tack that one on too. I didn't want to lose my credits in business, but wanted to really expand into something that I was passionate about. So I double majored in business and communication. And then in my first job, so I interned at ETV, and my internship was in public relations because I originally thought, okay, with a communications major, I might enjoy doing public relations. Then I did it and I didn't really like it because it was like clipping newspapers and looking for stories related to ETV to see how much press we were getting. And at the end of the day, I said, press was important, but press wasn't how I wanted to spend my days. So while I was in that internship, I started working with our community outreach manager. And I would go over to her and say, hey, do you have any things for me to do? Do you have any things that I can do with you? Because her job was to find our viewers, go out to our viewers, do events with our viewers, work with children, all of that stuff. And I really enjoyed it. So I ended up spending half of my internship doing the things I didn't like, clipping press clips, and then the other half of my internship driving all around South Carolina and meeting ETV's viewers, which is where I really got to get some good experience there. After that internship, I received a phone call and said, hey, Angel, you spent a lot of time with Cameron when she was here, and we have a position open. Would you be interested in coming to do her job? So my first job out of undergrad was working community outreach at ETV, traveling around South Carolina, doing those types of things. Then I hit an interesting juncture. So life always gives you forks in the road where you have to decide what will you do when you have those forks in the road. That fork in the road was ETV was always on the chopping block. There were always cuts, and I was a single lady, had just gotten my first apartment, and I said, can't afford to not have a job, so let me send out a couple of resumes. Even though I absolutely love what I'm doing, let me send out a couple of resumes. One of those resumes was to the South Carolina Hospital Association. Had no idea what they did, but they had a position open, and I said, this seems like it might be interesting. Lo and behold, in that random decision, I found my passion. I found healthcare. Before, I thought that healthcare was just about going to the hospital and receiving treatment, but I didn't know all of the things that went along with healthcare. And so in that opportunity, I remember walking through the door, not understanding any acronyms, and carrying a notebook with me and writing down all of the acronyms. How many of you find the acronyms in healthcare a little confusing? Anyone's with me on that yet? All right. It's like, it's a new one every day. And so coming out of ETV and into healthcare and all of a sudden having to remember all of those acronyms. But I learned a lot of great lessons from my internship and my first job. What were some of those lessons you guys think I learned based on what I've talked about so far?
Yeah, probably how to adapt to new situations and just be flexible.
Right. What else? How to build rapport with people. Exactly. What else? Those are good. Let's go with those. Thank y'all for raising your hand and participating. So I learned how to adapt, how to learn new skills, and how to make myself useful. So I started as an administrator, so I went from a manager to an administrative coordinator at the Hospital Association. So what did I do? I used that opportunity to work with different teams, to learn about what the organization did. I walked around with my little notebook with all the acronyms. I was hired to work with one job, but in that one job, I got to volunteer and work with 5 different teams in the association. Within 1 year, I was promoted to a program coordinator. Within 2 years of being in that position, I was promoted to a program manager. And then I had an opportunity to go and work with Palmetto Health. So jobs are not always about a title. It's not about finding the biggest title when you graduate. It's about finding where your passions are, understanding where your skill sets are, and looking for opportunities where you can make yourself useful and valuable in an organization. And when you do that, they recognize your skill set, they recognize your passion, and the title and the job and the money that you want will come to you when you put in the work. Does that make sense? Is that fair? Okay. So keep that in mind as you go on your pathway. Dr. Pearson talked about some of the things I did in my other jobs, so I won't spend a lot of time on that unless any of you have questions about some of the specific duties, like the community health needs assessment. I worked with school-based telehealth, some of those things. Any questions about actual experiences in the roles? Yes.
Not surprisingly, I have a question, but it sounds like you were happy at the hospital association in your role. You'd gotten a couple of promotions, and then something drew your eye to Palmetto Health, or what is now Prisma. Can you talk a little bit about that fork in the road, as you would describe it?
Absolutely. I love forks.
Because they're really great opportunities. So thank you. I'll share actually some of the navigation. That's a good question. So I was very happy with the hospital association. I'd received several promotions, but at the end of the day, I felt like the hospital association is a member-based agency created to support hospitals. Here I am, this great career path, but I've never actually worked in the hospital. I don't know the inner workings. So if a member comes to me and asks me questions, I can answer those from gut instinct and what I think the answer might be, but I've never been inside of the walls of a hospital as an employee. So I didn't feel equipped to really do my job well. So I always said, once I finished my master's, that ultimately I would work in a hospital. So that's the fork in the road. And it's interesting because I was not looking. I was very happy with the association. And one day I received a phone call and said, hey, Angel, someone saw you at so-and-so event, and they thought of you for this position that they have, and they'd like for you to come and interview for it. And I was like, no, I'm not going to do that. I like my job. I'm happy where I am. I'm not going. And they said, well, Angel, you never know. You might be interested. It might be something that you would enjoy. Why don't you just come and have a conversation with them and see? The position was actually an IT position. I had zero interest in information technology. But the reason why the person thought that I would be a good fit for this position is another thing about making yourself available. One of the tasks that we had to figure out at the hospital association in my first work, this is where I met Dr. Pearson, actually. It was when ACA passed, and high tech was before ACA. Everyone knows what I'm talking about when I say high tech, ACA, all those things, right? And we have...
Everyone may not. The ACA is the Affordable Care Act. Okay. Just want to make sure everybody's on the same page. So.
And high tech was the IT legislation that passed a little before Affordable Care Act to discuss how hospitals needed to have an EMR and just some standards that the government passed. And so from an association perspective, we now had this new legislation, and we had to pull together a team to figure out what that looks like, what it meant for our hospitals, and how do we help them understand that.
And not to interrupt you again, I just say we have several students who are from outside the United States, and I just want to add a little context. The Affordable Care Act was the kind of landmark legislation that was passed in 2010 that really shifted many things in healthcare in our country, but established the health insurance exchanges, but also set very different expectations for hospitals and for healthcare providers in terms of providing value-based care rather than volume-based care. And the IT-related aspects were basically to position hospitals to better share information, better manage patient data, and to be prepared for what would be a shift in expectations. So, sorry to offer that aside, but I just want to make sure.
No, that's
everybody's
a
on the same page.
wonderful aside, thank you. And to create standardization for the EMR vendors and things like that were taking place. So we had the opportunity to figure that out. So I was asked to be a part of a small team that would help read the legislation, understand it, and then ultimately put together learning sessions for our hospitals to help, for our hospital IT people to help them understand what those requirements were. So in putting together those learning sessions, I would run into CIOs and CFOs and those kind of people. And at a couple of the meetings, there was one I had a good rapport with, and she thought, she understands strategy. I have this job that's about creating strategies and plans. Planning class, fun, right? Creating strategies and plans, and she might be able to help us do that, even though I didn't have any kind of IT experience whatsoever. So I went, had the conversation, and ultimately really liked the job. Thought it was a cool opportunity. So my first job at Palmetto Health at the time was working in the IT department as a strategic programs manager. And in that role, I worked on our business intelligence plan, which was about how should the hospital use data to help them make good decisions and what solutions were available to help them do that. So I had to do research, pull together a committee, create proposals, identify vendors, lead vendor selections, some of that work. The other thing I worked on in that job was our mobility plan. What do y'all think a mobility plan is? No need to raise hands, just call it out. Sounds like it sounds like what it is, but it's kind of fun to get people to say it.
I have no idea. I'm hoping somebody in here does. Anybody have a guess as to what a mobility plan is about? You've stumped us.
Oh, I love it. It's fun. It's how to organize devices in a healthcare system. So this was before concepts like bring your own device were common. Before we were under the perspective that if a person used a cell phone, it had to be a hospital provided cell phone. But as we were moving into this new space of physicians wanting to download apps on their phones related to patient care, how do we make sure that people weren't violating HIPAA and doing these types of things? So it was really important for the health system to have a mobility plan for how we were going to handle things like bring your own device, what solutions we were going to implement. So stuff I knew nothing about ultimately. So when you're asked to do something that you don't know anything about, how do you learn? What do you do to figure it out? Y'all told me y'all were going to talk to me. This is 2 questions. Y'all have been quiet. So come on, help me out. What do you do when you're asked to do something and you have no idea how to do it?
You talk to the experts.
Right. What else do you do? Google it.
Google it. My BFF, Google. So Google, research, experts. That's what I did. I had to sit down in my office and figure out what are the resources that I have, who do I know, and where can I research? So that's what I did for all these projects that I received. I just had to figure it out. But ultimately, I also had to plan. Planning was critical. So I couldn't just figure it out and put it on a piece of paper, but I had to look up project planning templates. I had to look up how to write standardized business proposals. We had a membership to research agency. So planning had to be a core part of how I received these requests, and then I provided this information back to people that gave me the request. So very key part of the work. So now you're wondering, Angel, how did you end back up at the Hospital Association? Right? Okay. So a friend of mine, another thing do you notice? Did I ever land a job where I didn't know anybody? No, there's a theme here, right? There's always a phone call or someone that's like, hey, there's something coming along. Same situation here. Hey, Angel, I'm leaving. My husband has a job in another place, and I think you might be a good fit for this position. And I was like, eh. And so here's another really important thing when I say don't chase a title. When I left IT, I did it intentionally. I remembered what my passion was. I enjoyed research, I enjoyed working with people, but ultimately my passion was working in community. I liked working with people that needed help. I wanted to be closer to the people that needed services and not necessarily the bigwigs. Nothing's wrong with the bigwigs, nothing's wrong with them, but not necessarily the bigwigs that wanted the plans. I wanted to create plans that would impact people, not processes and systems. So I went for a job in the Palmetto Health Community Health Department. Now that job was a lateral move because I was a program manager in IT. I made good money in IT. IT is like good money, y'all. But I said, 10 years from now, Angel, where do you want to be? What is the career path that you want? 10 years from now, I did not see myself in IT. That wasn't the place where I wanted to grow. 10 years from now, I wanted to be doing community work. I wanted to go back to my roots. So I took a pay cut and a lateral title move to switch jobs in Palmetto Health and go to the Office of Community Health. I'm going to pause and let that sink in. Some of y'all would say that's absolutely insane, right? But do you know what my reasoning was? My reasoning was you work hard, you care about the work that you do, you want to make a difference. So money, title, all those things, they'll come if you do your work for the right reason. So I took a pay cut and I moved. Great move, because when I received the opportunity to come back to the hospital association, it was in community work, which is what I enjoy doing. So here I am. Thanks for that question. That led to like 5 more minutes of chatting.
But it does give a better context to your story and connect some of the dots for us. Thank you.
All right, so now what do I do today? So this map is, of course, these are the 2 primary programs that I work with. So I'm not going to spend a lot of time talking about the support that we offer to hospitals, because the support that we offer to hospitals from a community health lens is still being developed in some senses. So I work very closely with the Alliance for a Healthier South Carolina. And Lee and I were, well, Dr. Pearson and I was just, have to be appropriate in class. Yeah.
As you mentioned the Alliance, could you give just a 2-sentence description of what that is?
Yeah, and I also talk about a little bit of the history, because another random opportunity that we had together. So I first met Dr. Pearson about 15 years ago when he and a few others were developing an organization that is, does your class know about this organization that you developed?
More than they ever cared to.
Okay, when they were developing the Institute of Medicine and Public Health. And one of the things that we were dealing with at that time, again, related to ACA, related to the changing environment with hospitals, we said, we're going to be required to change. So how do we bring hospitals together to have them talking about how can they go further, faster together, and how can they collaborate and work as a team? So first it started as a group called the Reengineering Steering Committee. Then we said, okay, we need to have multiple stakeholders be a part of this group and not just have it be hospitals. So then we started to collaborate with the Institute of Medicine and Public Health, Blue Cross Blue Shield, other partners, and then we started something called the South Carolina Health Coordinating Council. Oh, baby, good memories of that, right? And then the South Carolina Health Coordinating Council, around that time when we stood that up, we created it. Then I left to go over to Palmetto Health, and the South Carolina Health Coordinating Council grew into something that is today called the Alliance for a Healthier South Carolina. How many members does the Alliance have now? Like
More than 50, I think.
Yeah, like almost 100, I think. So it is a member-based statewide coalition that brings diverse partners together, from hospitals to policy organizations to businesses like Michelin, and they have 4 meetings a year, and they come together looking at state health and how to improve health. And they have several different committees that are a part of it, like the equity, looking at equity, diversity, equity, and inclusion, like all types of projects that we work on collaboratively through the Alliance. Anything you'd like to add to that?
Curious by show of hands, how many of you have heard of the Alliance for a Healthier South Carolina? 1, 2, 3, 4, 5. They're scattering there. It has been around now, I guess, close to a decade, 15 years.
10
Well,
years or so.
I lost 5 years in there somewhere. Yeah, that's it. It is a unique entity that our state created that few other states have replicated, where you have so many different partners coming together to look at how to improve healthcare. One might say we have a greater sense of urgency to do that than some other states, but it is a really, I think, exemplary model for others to follow.
Yeah, and I'm glad that you mentioned it, because I should have added a couple of slides about it, because the planning relates to that really also. It's a very important part of it. So the Alliance worked with the Department of, well, I'll just say DHEC. Everybody knows what DHEC is, right? Okay. Worked with DHEC to create the first state health assessment called Live Healthy SC. And so I work very closely with the current director of Alliance, Monty Robertson, and we have, you know, every time we look at the Live Healthy state health assessment data, sometimes what we see is that data trending in the wrong direction all the time, right? But then we started to ask ourselves, this data is trending in the wrong direction, but there are things happening. There's a lot of work happening. And he and I, we'll talk about partners later, but through some other work that we're doing, we are connected with North Carolina. So North Carolina came to South Carolina and said, man, we love what you're doing with the state health assessment process. And they said, okay, so we're going to go back to North Carolina and replicate your state health assessment process. But then what they did is they layered a framework on top of that process. It's called Results-Based Accountability. Anyone familiar with that framework here? Okay, so results-based accountability is a way of starting with the end in mind, working towards the results that you want to achieve. So for their state health assessment, instead of looking at the assessment and saying, man, obesity is going up every year. Yes, they see that trend line data, but they also see obesity is going up every year, but we have 50 partners this year working on obesity, and here are the things that they're all doing in obesity. Next year, we have 80 partners working on obesity, and here are all the things that they're doing. So it's a way of combining the partnership and the results and using collective impact within that framework to identify opportunities. So in planning, Monty said, this is a neat framework. Let's bring it to South Carolina. So in our work, we're always looking for ways to improve things, looking for new strategies, looking for new ways to communicate things, and it requires planning, processing, research, and thinking through how you weave things together in order to continue to improve our work. Any questions about that?
Yes.
I'm just curious, because I know you made this for a long time. How long does it usually take to come up with a new strategy, like efficiently?
How long does it take to come up with a new strategy, you said? It depends on the task. And some strategic planning is an iterative process. So it depends. So for instance, programmatic planning. You will look at some examples, but you always want to look at your data. You want to sit down and think about what are the things you're looking to accomplish or that you want to accomplish, and come up with work plans and processes for how you do that. So to answer your question succinctly, the timeline varies depending on the depth of planning that you need to do. Okay.
I love that you use the phrase iterative process, because they've heard that a few times in this class. It probably didn't garner a really positive reaction, but it at least validates what we say about it. It's a tough slog to get through a planning process.
It is, because I say this to the team all the time. I'm a firm believer in, like, this is going to sound, so this is probably going to go against everything that you tell them, but sometimes you have to throw things up against the wall and see how it works. So you plan, you come up with a plan, you implement the plan, but then you coach yourself to understand that just because you come up with a plan, it doesn't mean that that's the plan that works. So you have to try it, and then if that doesn't work, guess what? You come up with a new plan and try that. So you have to be nimble, and you have to be flexible, and you have to be willing to adjust with your circumstances in planning. So what I actually work with, Healthy People, Healthy Carolinas, and Access Health. Are any of you familiar with these two initiatives? Yes. What do you know about them?
I'm familiar. I'm not familiar with Access Health. I know with Healthy People, Healthy Carolinas has done partnerships with Physical Activity Alliance, I believe. That's kind of my background from Dr. O'Neill's community physical activity intervention course. But I know that they have partnered with hospital systems to implement like insurance programs for like a coverage for gym memberships, I believe, with Silver Sneakers organizations around Columbia. That's my internship was at my undergrad, so that's the one time I've heard of them. But yeah, that's about as far as it goes.
Great.
Aware.
So,
I think we had a couple other hands go. Samantha and Dan, I think your hands were up.
I just know about them. My GA ship is with Liv Kershaw. So
I've met you then, Dan. We've been on meetings together, I think. Yes, nice. Tell Catherine Angel Bourdon says hello. That's my buddy. Yeah, great. Okay, who else?
I've heard of them because I did my GA last semester at IMPH, so we
work very closely with them.
Yeah, you kind of uses the Healthy People in 2020, 2030 goals and tries to like make sure that they're implemented and like doing that in South Carolina.
Great, yes. So I love hearing these different perspectives of the work. So when you work on a statewide basis, one person can't touch everything, right? So when you work on a statewide basis, the way to accomplish our goals, I'm going to move ahead and then come back. The way to accomplish your goals is through partnerships, aligning with other organizations in order to meet deliverables. So Healthy People, Healthy Carolinas was started in 2018 here in South Carolina, and the Hospital Association, along with other partners, came together and decided what this initiative should look like in South Carolina. And so the way that it works is the Duke Endowment funds SCHA, and we work closely with other partners to deliver technical assistance to the communities that they've selected for Healthy People, Healthy Carolinas. Someone give me a succinct definition of technical assistance, and I'm going to go get water while y'all are doing that. What's technical assistance? TA for short, we call it.
You guys have a good definition in mind? I hope so, because I don't. So hopefully one of you guys want to.
What do you think it
Jesse,
is?
you
Doesn't
look like
have
you're
to
ready.
be-
I don't know, but I'm going to guess.
Yes. Yes.
I would assume technical assistance would be like,
What does it sound like?
Joey?
No, I'm just saying we believe in you, like sending you good energy.
We
Oh, yeah.
we all believe in you,
I'm
Jesse.
gonna
Hey, but
assume-
guess
I'm gonna
what?
assume
I have
that
a
technical-
policy. There's no wrong answers. This is a discussion.
incorrect.
You have backup behind you, Jesse, if you need it. You have a hand up.
Okay, so I think technical assistance would be like the collaborative hands-on work that, so like my organization can do something that the organization can't but needs, so we can collaborate on that, and I would assume that that's technical assistance.
Close, very close.
That's
And there's
general.
another hand behind me.
I was gonna say like, I guess the more like straightforward things, not necessarily like, I don't know how to explain it, but like, I guess like, for example, if you have like a campaign, like you're helping with like the funding, things like that, where you're not necessarily helping with like the way that the campaign is portrayed, but it's more so like the hard, fast, like technical aspect of it.
That's a really good definition. So both of you guys are you're hitting some nails on the head here. So and this was something I learned in this job. So theme today, most of the time I start a job and don't know what I'm doing and I have to figure it out. So don't let yourself be afraid when you receive opportunities. Sometimes you just learn them, right? So as you know, I do not have a public health background. I'm an MHA, so I love public health people. Y'all are my favorite people in the past 2.5 years, because Healthy People, Healthy Carolinas is really an initiative about working in healthy eating, active living, and chronic disease prevention. So the Duke Endowment funds 10 coalitions to do that work. So they give them $150,000 a year for 3 years. The 10 coalitions that they fund as a part of their receiving funding from the Duke Endowment, they have to work with the Hospital Association. So Dan, that's how you know me, because Catherine, and I think Dan, you've attended some of our meetings. We do learning collaborative sessions where we bring them together to talk about the work that they're doing, what they're implementing, challenges, barriers, those types of things. We have coaching calls with them, and on those coaching calls, we're identifying what interventions they're implementing, how they're implementing them, giving them guidance on that work. And then, last but not least, which we'll talk about a little bit later, we receive their data. So as a condition of them receiving funding from the Duke Endowment, they have to report data biannually, and we provide guidance to them on that process. So technical assistance is a catch-all term to do just what you guys said. It's to work with those communities, build their capacity for the work that they're doing, coach them, guide them, and then make sure that the deliverables of the funder are met. So they have to turn in their reports, they have to turn in their data, have to do all those things, and guess what? It's our job from a TA lens to make sure those things are happening. Easier than it sounds, right? Sounds like, yeah, that's straightforward, that's easy. So Dan, I want you to tell us a little bit about your GA-ship with Live Well Kershaw. What are you guys doing? What do you see firsthand in that work? Because that's one of our 10 coalitions that we work with.
Sure, so I can only really talk fluently about the areas that I've been working on. Just, I know Catherine does a ton of stuff in the background that I'm not always privy to, but so the big project we're working on right now is basically a collaboration with United Way Kershaw County. It's called the Vehicle Access Network. It's sort of a direct service bus line in Kershaw County, so people can call in to United Way Kershaw County, and we've contracted with a transportation service, and they can pick people up and take them from point A to point B. The idea being that we're going to be reaching out to rural populations and connecting them with resources such as dialysis, medical appointments, grocery shopping. In fact, actually, for the past 2 weeks, I've been doing data analysis on our first couple months of trips. We're at like about 300 since November.
I saw that data, it was rocking, like you guys were doing surveys on where they're going, and that was really helpful for me.
Yeah, you'll probably see this, but I just finished and sent in a data analysis sheet that has a lot of infographics and stuff. But yeah, no, it's been really, really successful, and probably the most surprising thing is the sheer number of people using it for dialysis transport. Like, I want to say ballpark about 60-ish plus percent are using it for medical purposes generally, and about 36% of those people are using it specifically for dialysis. So that was kind of unexpected, but definitely not a bad thing.
I wonder how they were getting the dialysis before.
Right, and I appreciate you sharing that, because what I love about Healthy People, Healthy Carolinas, I'm not partial or anything, is that typically a funder does not give you money and say, go figure out what you want to do with it. But that's essentially what the Duke Endowment has done. They say, here are the topics. Your guardrails are healthy eating, active living, and chronic disease prevention. And now we're going to let you go in your community and implement things that directly relate to your community's issues. And so that's why they say they have to work closely with technical assistance, because they want to make sure that we're vetting those interventions, that we're ensuring that they fit with the guardrails So Catherine and I got her intervention to work because she says, well, they have access to healthy food and other things as well. But we're, like you're saying, we see through the data that they're also getting access to care resources. They're picking up food share boxes. They're doing all kinds of things with that transportation service. So we see coalitions implementing things like trails, school-based interventions where they're exercising with kids and showing them how to eat healthy foods. We have faith-based interventions where they're going into churches and removing the salt shakers off the table, or building community gardens in low-income neighborhoods where people are learning how to grow things. And so all types of work. Yes, Dan?
I just wanted to add in that same vein, one of the things that they're getting more into now with Live Well Kershaw in the county is moving a lot of health resources into libraries. And that is like super, super popular. I don't work specifically on that, but I've sat in some meetings where that's been discussed, and everyone is really, really excited for that.
And one of your instructors,
Dr. Weiss is smiling wherever she is.
Dr. Weiss, when she watches this video, that's gonna make her heart sing, because that's a personal passion project that she's brought to South Carolina. And again, we'll talk later about it, but collaboration and partnerships. Thank you for sharing that. Access Health, so Healthy People Health Carolina, we work in 16 counties. Access Health works in 36 counties, and we have 12 networks, and we do technical assistance for them as well. So the same things that I talked about for Healthy People, Healthy Carolinas, we support those networks, but what that looks like is a little bit different, because those networks are creating networks of care for low-income uninsured individuals in South Carolina. So what that means is they create these little hubs where there is several staff individuals who enroll uninsured clients into their program. And then when they enroll those uninsured clients into their program, they make sure that they have a medical home, that they have access to specialty services. They screen them for social determinants. So if they have food issues or other barriers, they're able to refer them out to where they need care. And you see Kershaw, that Dan is working in, is one of our counties that has an Access Health Network and a Live Well Kershaw. Have you gotten to work with Access Kershaw at all?
Maybe, do they do work with the clinic with Susan?
That is, yep, Access Kershaw is in there, and Lindsay is the director. So from a technical assistance lens, when we think about our shop is to make sure that all of these counties that we're working in, that the work is being done as designed, that the deliverables of the Duke Endowment are being met, and then also we connect them with each other and look for research and opportunities to help them to continue to grow and expand their work.
yes.
I love this colorful map, but I'm a little worried about 5 of our counties, Lancaster, Chester, Aiken, Allendale, and Colleton. They are not purple or green or a blend. So the beige counties, why are they not involved in these 2 initiatives, and what can we do to help them?
So as a matter of fact, that's a really insightful question. There are currently 10 counties that are not served by Access Health. So it's this little area here in purple, this area here, and then these 3 counties up here at the top. So we were asked, so our leadership team went through this process where they looked at Live Healthy goal and priorities planning process, went through this process, they looked at the data. Based on the data, they took that data to our board members who are all hospital representatives, and those hospital representatives said, out of this data that you're sharing, we can't do anything about all of these things, but there are some of these things that we can impact. So they created a plan based on that data of Live Healthy priorities that they would be willing to commit to work on over the next 5 years. Our evaluation team created a plan for the Hospital Association that says, these are our Live Healthy priorities. These are the things that the Hospital Association will focus on over the next 5 years. And then they divvied out that plan to staff. Fun, I'm kidding. But part of that process was to say, how do we increase access to care, and one of the strategies that they have requested as a part of increasing access to care is to do just what Dr. Pearson referenced. How do we look at the 10 counties that we're not serving and identify opportunities to either expand Access Health or create something different? So I am in the midst of a very intense planning process with a graduate assistant that we've hired on to do the work, and we are pulling data from various sources. RFA, acronym, what does RFA stand for? I'm losing it right now.
Request for applications or?
No, the
You're talking about
data.
revenue and fiscal affairs.
Yes, Revenue and Fiscal Affairs. Are you?
Basically the Office of Statistics for the state, data and statistics.
So we have a really close relationship with them as a hospital association and can gather data. So we are pulling data looking at patient utilization patterns. How often do patients leave their county? When they do leave their county, where do they go for care? What types of services are they receiving when they go for care? Researching what the Access Health staffing models look like. What do those staffing models look like? What's common? What's best practice? What's standard? Uninsured rates in all of these counties. All of that research is going to inform us creating a plan for those 10 counties for how we could create access across those 10 counties. We actually have some funding from Dr. Weiss's shop, the Center for Rural and Primary Health Care, to help us look at that. But at the end of it, we are going to create a business plan directly related to those 10 counties. When we create that business plan, we are going to, we see at this point 2 different possibilities. So if you look at this map, Colleton is next to a couple of Access Health networks. Aiken is next to a couple of Access Health networks. So we see that we may be standing up new networks in some instances, or we might be looking at how do we fold counties into other counties or establish resources in those settings. So planning processes is really important in order to help you to make good decisions, and you don't rush it. This is a 5 to 6 month process that we've been going through to do this research. Yes, Dan?
Based on that, I mean, would you say in a sense that it might be better to sort of visualize this as like regions, in the sense that we know people will travel for care? So, you know, like you were saying, Aiken might not have its own network, but it is being served likely by Edgefield, Saluda, and Lexington. So would that be the better way to think about it in a certain sense?
Potentially. So I'll use Aiken as an example because that's when we were literally, so y'all are hearing about planning in real life that happened just this week. So yesterday we were looking at the data and I said, okay, our Aiken data tells us right now that where people go for care is Lexington Medical Center. When they have an emergency visit and even an inpatient visit, I think it was about 30 to 40% of the Aiken County visits were out of county, and when they went to Lexington. Here's a nuance. Our current Access Health network is housed at Prisma. The Prisma Access Health network serves Richland, Lexington, Sumter, Fairfield counties. So my conundrum now is, from a planning perspective, if patients go to Lexington, but there's not an Access Health network necessarily that's a hub at Lexington, what other information do I need to make a recommendation about what we do about Aiken? Is my recommendation going to be Aiken should be a freestanding network and we plug them in to a couple of different sources and then bring Lexington Medical Center in as a service provider? I don't know. So then you get data, you look at that data, you have a new question. So then when you have a new question, you have to sit back and go, oh, darn it, what are going to be my resources to help me answer that question? Is it me going out to the sites and talking and having conversations with people to figure out what they're doing and how it works? Or is it me requesting more data from our team, pulling data? So you have these different pathways that you have to travel down and try and figure out what your answer is. Good question, though. Thank you, Dan.
So I'm from Aiken, so thinking about maybe more of the House connected to Georgia side of things. Are you taking into consideration the like Augusta Medical Center? Because it's so large and huge. I know that it services a lot of McCormick and Edgefield and Aiken and Barnwell and Allendale. So are there already organizations that are operating in those counties that maybe provide similar services?
Yes, so that's another good question. We have that conundrum at the top and down here. So up here at the top, York, Chester, and Lancaster are not Access Health sites, but Atrium has a massive presence in those counties. And Atrium has an Access Health. So then that leads, again, to a new question that I was just talking about yesterday. It's so great you guys are asking these questions. Okay, if Atrium has an Access Health, but they're serviced by North Carolina TA, what's going to be the best pathway for me? Do I talk to North Carolina TA? So all these things lead to more questions, but the onus is on us to find the questions, do the research, document those questions, and then keep going until you get to a solution or a recommendation.
Just for folks who don't know the geography well, Atrium is based in Charlotte. The city of Charlotte is pretty much in that little wedge there at the top of York County. So to the point, we have metropolitan areas that border South Carolina that would draw people. And I appreciate you asking that question, Jesse, because I was sitting here thinking, well, if I lived in Aiken, I'd probably be going over to Augusta rather than coming all the way to Columbia for my care. And I'm also mindful, and you're the professional with the hospital association here, so I'll say this so you don't have to, but most hospitals don't get along with each other real well. They're kind of competing for each other. And so as wonderful as elected I know that comes as a news bulletin to you, but when you think about Prisma and Lexington Medical Center, which are only separated by a few miles here in Columbia, they're in constant competition with each other. And, when I worked in Florence for McLeod Regional Medical Center and Carolina's health system opened, the competition was just truly fierce. I mean, they were battling each other in the newspaper every day and publicly shaming each other. And I was like, look, people, there's enough illness to go around.
There's plenty of sick people to go around.
People are dying by the dozens. I think we can all succeed. Let's quit stabbing each other in the back and just try to maybe focus on the patients. But there are numerous kind of political, financial, social, and cultural issues that drive this, in addition to the layers of geography, proximity, logistics. So it makes Angel's job challenging. But I am concerned about the beige counties, so when I lay my head down tonight, I'm going to be saying a little prayer for the beige counties. I'm a little worried about them.
And now when you say your prayer that our data and our conversations lead us to good recommendations for those beige counties. So I looked at my watch. This has been such wonderful conversation.
I want to go for another 20, 30 minutes.
Okay, all right. Awesome. So I put this together because I wanted to ask you all a question. How many of you love group work, group assignments?
All of you should say yes because your group partners are listening. So everybody nods.
Let's call it what it is. Even if I loved my group partner when I was in undergrad and grad, group assignments were not my favorite. And I love people. Y'all see I'm a chatty Cathy. I can talk all day long. But ultimately, group assignments required me to work around schedules, figure out time to meet up, decide who's going to take this portion of the task and who's going to take this portion of the task. And it just felt like an extra layer of complication when I can pound it out in my room by myself without having to do all of that. Guess what I do now? Group assignments every darn day, everybody. So my whole job is group assignments. And so when you enter the workforce, it's really important to be a good partner. So the skills that you're learning in those group assignments, making sure that you're taking on your part of the task, being willing to share ownership and responsibility with other people, recognizing people's different strengths and their contributions to a team or to a project. You may be a really organized person. Someone else might be more of a strategic thinker. It's okay to divide the group project based on your skill sets, okay? Because those are things that are going to be very transferable into the work that you're doing. My group partners, how I respond to them. What the deliverables are with that group partner depends on the stakeholder and the role that they're playing in my life. So my funders, I know that when I'm approaching them about things, the context of that, I have to be conscientious of that. When I'm working with my partners up north with NCHA, I know when I'm approaching them about something, I have to be conscientious of that. So definitely understanding your audience, understanding what you're trying to communicate, and working collectively with people are important principles as you move into the workforce. It's a lot of logos, isn't it? And I didn't even list everybody. There are a lot of people missing. So we work with a lot of different people.
Yes, North Carolina Healthcare Association.
Okay, so great question. So Krkanova, so the Duke Endowment is a very large funder that's in Charlotte, North Carolina. But their work is across the Carolinas, North and South Carolina. And they have a healthcare division within the Duke Endowment. And because they fund North and South Carolina, their key partnerships under that healthcare division is the South Carolina Hospital Association and the North Carolina Healthcare Association. A couple years ago, they had this bright idea and said, we're going to form an innovation entity. That innovation entity is going to bring together NCHA, SCHA, and the Duke Endowment. That entity is called Krkanova. So that's why my title is Community Health and Innovation, because the innovation component ties into the work of Krkanova, which includes all types of things, serious illness care, hospital at home, all types of things that they're still building out. So that's why we are working with NCHA to create a lot of shared strategy. So NCHA has a Healthy People Out the Carolinas. NCHA has an Access Health. So literally, I do group work every day with the folks from NCHA in terms of what processes are we using, what technical assistance are we providing. So it's a lot embedded in that. Thanks for that question. All right, how many of you love Zoom? Yay, okay, I got some hands raised, good. Okay, pre-COVID, my life was on the road. So pre-COVID, I spent 3 to 4 days a week hitting the road, traveling South Carolina, going to our different sites. Post-COVID, this is my life. 90% of my job is on Zoom or Teams. I'm not a big fan of Teams, mostly Zoom. And I became accustomed to driving on the road and having time to like process and think about a meeting. And now, not in this environment. In this environment, they're back-to-backs. Boom, 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 boom. But what I've found is, yes, it can be a little daunting, but at the end of the day, I'm able to cover a lot more area using these virtual platforms than I did when I was on the road, driving from one place to another. So now we get to make intentional decisions about if we're going on the road, it's because we really need to be there and we got to handle something in person, face to face. But other than that, this is most of my job now. Doesn't that sound exciting? I see the yeah rights over here, yeah. All right, so now we've talked a lot about program planning and what that looks like in practice, but I'm going to show you guys just a glimpse of some of the tools that we use. And I'm also going to talk you through thought processes with these tools. So this is an example of a work plan that we actually received from Dr. Weiss's organization that we have adopted and we use it consistently. It's, what are our objectives? Where's my little clicker? Y'all see? Oh, there it is. So here, the date, instructions on the work plan, and then it's usually multiple pages because we're looking at the objectives, the task, the expected outcomes, outcome measures, and the frequency. So now we've started using, so I have to tell you guys, I was introduced to the principles of project management when I started my IT job, and y'all know where that was, like right on the front end of the career. I did not like it. I thought it was just, so many things to keep up with, all these lists and things like that, and I thought, why would anybody want to do this? Fast forward 10 years, I love it because it helps you sit down, process. I think about what the steps are that need to be taken in order to achieve your goals. And then when you think about what the steps are that need to be taken to achieve your goals, then you know what you're working towards and you're not just working haphazardly. You had something to add? Okay, all right. Another tool that we have recently started using. Any of you use Microsoft Planner? You like it? Okay, so I have to tell y'all how I stumbled across this. The position I'm in now was newly created, and so before my role was just working with Healthy People, Healthy Carolinas. When I worked just with Healthy People, Healthy Carolinas, I had a team of, it was just 2 of us that were on task with Healthy People, Healthy Carolinas. So the way that we kept up with what we needed to do is I had my list, we had our goals, we had our strategic priorities, and then within our strategic priorities, we each had our goals and deliverables that we needed to meet with Healthy People, Healthy Carolinas, and it was just 2 of us. So I knew she was on it, and I was on it, and we'd come together and meet bi-weekly and talk about what we were doing and how we were moving forward. That worked. We got stuff done. Then I got new responsibilities and more people, and when you have new responsibilities and more people, there's a lot of tasks, a lot of deliverables, a lot of plans that are now floating in the air. We think I'm managing 5 or 6 grants. So when you have that many things going on, you really need to think intentionally about how do we make sure that everything's moving in the right direction and that everyone knows what their duties are and that we're working together to achieve the goals associated with our work. And so just 2 weeks ago, hot off the presses, everybody, we built out Microsoft Planner, and so this is something that we've started to use in our team. We love it because they're all list people like I am, so we just go in, we put our stuff, and then they know what I'm working on, I know what they're working on, we can tag each other with notes in it, and so it's just been a really useful tool for us. Any testimonies about it?
I used it my first year as a research assistant. We had 3 NIH projects going on at the same time, and it made knowing which meeting you're hopping into a lot easier. That's pretty much what I used it for. So this is actually an updated one. I haven't seen this layout. But no, it's helpful if you've got multiple projects you're working on.
And because we're managing grants, we have a work stream for the grants that we're handling, and then we have a work stream for technical assistance, and so it just keeps, the person that's leading this grant, they know, and then we can tag each other in questions instead of having to send 100 emails. It's just made our life a little bit easier. This is, again, another way that you can organize things in progress, what's left, still building it out. And then I keep it open all day, so I'll go in and look at it and say, okay, what are the things I need to do today? Or what are the things that we need to do today in order to make sure we're moving these projects forward?
So my Jacob and right now, we're currently doing 2 different grants at the same time. It's with ADRD. So with there's 2 different Alzheimer's disease grants that we're working on. If my boss was trying to think of ways to get all the GAs in one thing, and we haven't heard about this yet. But we tried Asana.
I heard of Asana.
Okay, not my favorite. This looks a lot easier to use, but it's difficult because everyone's kind of used to their own system, including my boss. And it's just hard to break. So I was wondering if you have any tips to how to move the transition along more effectively.
Yes.
So what we're doing is, like I said, we just launched this about 2 weeks ago, and we built out the buckets collectively. So we talked as a team, what would we like to see on this? And now the expectation is, and this is what I said to them, and I think it's important for your boss to think about this. I said, I don't care about what you're doing. I don't want to be a micromanager. I don't want to look at your task every day. That's not my goal. But my goal is to create transparency across our team about the things that we need to do to move these projects forward. So in order to help with the transition, brainstorm collectively things that have helped or things that are hindering. So I asked them, I said, how is it? Is it burdensome? What's your workflow? Are you using it every day? Are you using it once a week? Like, what works for you in terms of your workflow? What types of things do you want to document in here? And what types of things do you want to keep on your own? So we have a weekly meeting. And so we're using our weekly meeting as time to talk through if this is working for them and if it's not. And I'm a firm believer, like I said, I like to throw things up against the wall, right? You plan, you try, and then you do PDSA cycles. Plan, do, study, act. If this is something that doesn't work for the entire team, then we may need to find something different. But so far, they're really enjoying it. They like it. They said, we started doing this because you have to think about the different personalities of your team members. And I was starting to notice that one of my team members was like, she's relatively new, and she started to be like, I don't know what I'm supposed to be doing. There's so many grants. I don't know what my deliverables are with the grant. And I said, all right, we have got to come up with something that we can work on collectively to help her start to process what those deliverables are. And then I talked to her this morning on my way in, and she's like, this week is a much better week because I know what I'm doing, and I feel so, it's that check-in process, talking about what's working for others and then what's not working, and then making adjustments as you go. That's the best advice I can give you. Any other questions?
This isn't directly related, so we'll chat about this afterwards. So our Dean's Advisory Council is meeting today, and I'm putting forth a proposal for like a survey to go out to like GAs and research assistants for like workplace mentorship, communication satisfaction. So how do you feel about your supervisor? Is it going great? What resources would you recommend? Because I know that we have like workforce development at USC, which is great. And so what resources do you recommend whenever it comes to talking to a supervisor about like effective communication if they haven't necessarily been trained on it? Because a researcher may be brilliant and great at what they do, but maybe they haven't been trained on how to communicate very clearly.
That's a good point. So I can say that I've been very great. This was a really great thing about working at Palmetto Health, because Palmetto Health really offered a lot of trainings for us in terms of when you entered into management. We did a training on crucial conversations, how to communicate. We did practice cycles and things like that. And so earlier, like I said, Google is your friend. Google things like crucial conversations. There's a curriculum out there, some literature on how practices and strategies for that. So Google, how to talk to employees, things of that sort. Because the thing is a person can be the smartest person on the face of the planet, but if you don't know how to gauge how people are feeling, if you don't know how to ask questions about what's working well and what's not working well, and if we're not willing to make adjustments in partnership with our team members, then you can be the smartest person in the world and have the most unhappy team. So do research on like team-based environments, team building, that kind of stuff, and then maybe put together a portfolio of information that you could share with individuals to help them in that development. Thanks. All right, so that's my planner stuff. I'm geeking out over my new tool, everybody, so I'll skip through it. This is my worst nightmare, but we have to use it. How many of you saw the Salesforce Super Bowl commercials? No, Matthew McConaughey floating through the air. Okay, yeah, I got a buddy. Okay, all right. So this is one of those things that our funder has selected a product. We use that product. Our coalitions and networks hate it, but we have to be the Pollyannas for Salesforce and help everybody use it and figure it out. But the reason why this is important is this. Sometimes you have to make sure that you're capturing data, that you're putting that data in the appropriate places, and then that you have some way to visualize that data. So Salesforce is our behemoth that we have to enter all of our data into, but then we have Tableau so that we can use that data for decision making. Any questions about that? Okay. So here, evaluation. Anybody has any neat quote about evaluation that I can steal from today and use?
Dr. Weiss probably would, but you're going to about it.
Oh, okay. So Again, things I've learned. I was having this conversation this morning with our new team member. I was not always a data person. My undergraduate degree in business and my MHA in statistics and all that stuff like gave me intense heartburn, and I thought that I would never appreciate it or value it. But in the workforce, I've come to realize that evaluation and data, it's how you tell your story. It's how you demonstrate that what you're doing is valuable. It's how you ensure that you're moving in the right direction. So when you're developing a program, on the front end of development should be how you're going to evaluate it, what you're going to measure, why you're going to measure, and what outcomes you hope to achieve in that process. And not just measurement in one place, but you want to measure in multiple dimensions. So yeah, the Duke Endowment requires me to gather all this data on program outcomes. Yep, got it. But I don't just need data on program outcomes. I need data on the effectiveness of my technical assistants. So just like what I was telling you about, I do pulse surveys throughout the year to say, are you getting what you need? What could be improved? What learning sessions would you like to see? No one told us we had to do that, but when you're working with community members and you're creating content and doing things to help them, you have to have processes for how you get the answers to the questions that you're going to have about your work. Any questions about that? Yes.
As a person who likes to be involved in the community, like you said, how valuable do you say focus groups are?
Okay, so I have a bias here. So we talked earlier about me working with our community health needs assessment when I was at Prisma Health. And so our strategy for that, we did surveys, we did interviews, and then we did focus groups. And our interviews were with our leadership, but then our focus groups were how we got to the community. A focus group is as important as its design. So we designed our focus groups. We went to certain communities. We were intentional about trying to fill in gaps from the survey with our focus groups. And then we had actually worked with School of Public Health to help us develop a methodology and a training for how to conduct those focus groups and how to capture the data. So I say that they can be important, they can be a good way to get the voice of the community, but you also have to be intentional with the design and the implementation of that focus group. Was that helpful? All right, thank you.
That was a good pulse survey that she just did there. Was that helpful?
Look, all the time, I'm doing, because you say something and that may not be the question that someone actually wanted you to answer. So I'm like, tell me if it's not, can't read minds, so I got to do a pulse survey in the process. So, the end. Any questions, guys?
So I'm not sure if this is access health. I'm a dental hygienist, and I know I haven't had a chance to partake, but there is something that's put on, I think it has something to do with the name access, but it's like a pop-up kind of event of healthcare providers, and I think it's mostly prevention. I know that they have dental, but I feel like they have other things too, like where they were doing some kind of health screenings and things like that. And one of them, I think, was in Charlotte, and I think one of them was at the fair. I'm not sure. But is that something that you guys do? Is that your work? Is that?
Mission events, probably.
Yeah, those were mission events that were a huge production. I don't know that we've had one, certainly not in the COVID era, but those involved multiple partners, and we're really trying to identify and serve individuals who are not connected with care. So they would look at basic mental health needs, oral health needs, basic physical issues, and they would get volunteer providers to come, say, for a weekend and be at the fairgrounds. And there would be thousands of people that would line up for these events. To my knowledge, we have not done one recently, but they, I do think it was like Mission 2020 or Mission 2018 or whatever, they would have catchy names like that. But it was, I think, kind of a community service effort to meet the needs of the uninsured and those who are truly disenfranchised from the system. But I have not been aware of those happening in recent years.
So
So the
The first one we held was in Greenville, and then we had another one in Charleston, but then Columbia was the community that adopted them and kept doing them every year. Well, at the time, when the mission events first started, there were not any access points really for dental care or vision care. And so what would happen is our lines, you'd see people lining up, like our first patient lined up at like 2 o'clock in the morning, and she was an elderly lady that had walked more than like miles to get to this mission event, and I'll never forget it. She had her cooler, and she was sitting on top of her cooler waiting, lined up at 2 o'clock in the morning for an event that was going to start at 7. And it was for dental services. And that's what we saw, dental and vision, those were the needs. Well, as a result of the mission event, at the time, United Way of the Midlands was a huge part of that, along with Palmetto Health, and other partners, Lexington Medical. It was a group of people that did it together. So they came together and created facilities in Columbia for dental services and vision services. Once they had those facilities established, they felt like the need for that yearly mission event was no longer necessary, because now they had places where they could refer the uninsured to for, so there was always an access health here, but there weren't places where they could really refer people to for dental and vision services. So that's why they haven't had them in a couple of years.
I remember seeing that in Orangeburg, just how, the provider to population ratio was really, really bad. So, I know that they're big productions to put on, but, I mean, I wonder if that, like bringing something like that to areas that didn't really, there's no structure. I mean, maybe a few times a year, I don't know.
There is a new service that's going on that you guys should look into this. It's called Healthy Me, Healthy SC. It's a partnership between MUSC, Clemson, and some others, and they've been able to use some legislative funds to establish this group. And what they're doing is they have priority counties, and they're going to those counties and doing health fairs and bringing in partners into those health fairs and setting up referral opportunities. Their first health fair was in Barnwell. They're having another one in Williamsburg. So there is kind of like a microcosm of that work that's happening right now, and we're partnering with them on different things and looking at how Access Health could be there for uninsured referrals and things of that sort. So there is some work taking place related to that.
Like catching fish in a barrel in this state. The need is so great.
the need is so great.
I should know this, but I don't look at this day to day, but can you remind us if you know, what is the current uninsured rate in South Carolina?
I started talking, and I wish I had that, because I was looking at it. I read a stat actually this week for one of the counties that we work with, and they were talking about how it was 20% before ACA, but it was 13% still in their county. But then we were looking at the data of the uninsured enrolled in the program, and they had maybe 3% of the uninsured. So there's still such a great need, and that's one of the things that we're doing in Access Health, is trying to make sure that we're maximizing enrollment and then those case management services, so we really can get to that percentage of people that are uninsured in a county. But I need to get that for the whole state.
Yeah, those numbers are familiar to me from the last time I looked, but I just wasn't sure, particularly with COVID, with the unemployment that occurred at the beginning of COVID, especially how those numbers may have changed.
We're seeing stories though where with COVID, people weren't going to the doctor for a while, and then as they're going back into the physician practices and things of that sort, there are resources set up there to help them get enrolled on the exchange. So, I'm keeping in touch with Palmetto Project to look at if we're seeing an uptick of enrollments as a relation, in relationship to the loss of employment and things of that sort, to looking at how the exchange is playing a role in all of this.
So I want to preface this is definitely a little biased because I'm in the middle of going through LMC's orientation. But I know LMC has a pretty big reach. Sorry about it. Like 3 Main Street.
Who does?
Lexington Medical Center.
Yep, they do.
So like, how did you kind of decide to like set up with Prisma versus LMC, or like, how do you decide what hospital association, or what hospitals to do the Access Health through?
That's a tricky question. I'm
Yeah.
glad you asked it because so the Access Health in Richland County with Palmetto Health was actually the first of our kind in the state. So our current COO, who was my boss when I was there, she was a director of, it was called Richland Cares at the time. You remember that? She was the director of Richland Cares. It was the Access Health model, and they received funding from the feds to implement that at Prisma Health when it was Palmetto Health. When the Duke Endowment decided to invest in that model and take it statewide, she was asked to come and lead the development of that model. So when you have an Access Health network already in a hospital in a region, ideally what you do is create partnerships with the neighboring hospitals. So it's a byproduct of that Palmetto Health is the Access Health network, but they do refer to Lexington Medical and have like some spots with them. Now, in counties where new Access Healths were established, if you could see my mask down, I'm making a face. Like that was always fun, you know, getting all the hospitals in a room together with the free clinic and the FQHC and really trying to get them to focus on the needs of the patient and using data to drive that discussion. But knowing that there can be difficulties in relationships with hospitals, that was always an adventure when I was first in this work. But, you know, they collaborate and they work together where they need to. Thanks for that question.
What other questions do you have for Ms. Bourdon? This is super general. I'm just curious about your outlook. So thinking about especially rural healthcare access, since you're like on the ground with working with access, what is your perspective on the outlook of healthcare access in a state like South Carolina? Like, are we improving? We have a lot of programs going on. We have really great people who are trying to do the best they can. But what does it look like from your perspective?
There needs to be a lot of capacity built in rural. When we look at the data over the past few years and see all of the closures that we've had in our rural counties in terms of hospitals, and then another trend that we see is freestanding emergency departments popping up in counties and things like that. You cannot receive ongoing care at an emergency department. And because primary care, you look at the rates of primary care physicians in a service county, kind of like what you were looking at with the dental services. In some of our rural counties, that's really low. So I would really like to see from a South Carolina lens investments made in building capacity for rural providers and creating more medical homes or ambulatory care centers that serve these rural counties or located in rural counties. You know, we heard from Dan's story that transportation is an issue, right? So if transportation is an issue and the only way for me to receive care if I live in Barnwell County is to drive to Orangeburg, then how do we create programs and structures to help with that? So I would say there are lots of people having that conversation. I just had a conversation yesterday with a funder where they're like, hey, we want to do some capacity building in rural. So the conversations are happening, but it's definitely a long road to continue to build capacity in rural.
Good question. Any other questions? Dan?
In that same vein, how much of an emphasis, I only know our program, you know, Lowell Kershaw, but, you know, outside of that, how much of a push has there been for sort of sustainability in building these models? Because, you know, obviously a lot of this grant funding does run out at some point unless you can get a renewal. So how much of that is going into the strategic planning of, okay, so after the 2-year period or after the 3-year period, what's your game plan for getting this continued? Because at least some of the discussions we've been having with United Way Kershaw County is, well, and also with SWARTA and their bus line is, okay, if this is successful and something we want to continue, you know, you need to start thinking now about the stakeholders you want to reach out to in the community to maybe get taxpayer money, for example, to pay for this service as opposed to private grants. So is that a conversation you guys are having in other locations as well?
So Dan, you've just like hit the nail on my number one anxiety reducing thing with the communities that we work with. So it's like, particularly with the funding cycle that we're in with the Duke Endowment. So we really work with them on, okay, anything that you invest in, from the day that you invest in it, you should already be thinking about sustainability. So you should be looking at other partners that would be willing to fund this. You should be identifying other grant opportunities. You should be investing in something that maybe the school says, okay, we'll take it and run with it once you've made this investment. Because the last thing we want to do is throw money at things and then have them go away when the money goes away. So sustainability is always a core part of our coaching. The other thing is y'all hear me use this term a lot, multiple dimensions, right? So one part of sustainability is sustainability of the program and the thing that you implement. But the other part of sustainability is sustainability of the people to do the work and keep that thought leadership ongoing. So we're constantly talking to folks about that and working on that topic. I love this class. Y'all ask good questions. I like it.
They're awesome.
I know.
Any other remaining questions? All right, please join me in giving Angel Bourdon another round of applause.
I'm going to give y'all a round of applause because y'all were great, and I really enjoyed having the opportunity to talk to you this morning, and thank you for your questions and your engagement, and you just smiled the whole time on the front row and made me feel really good, so I appreciate y'all. Yeah, that's right, the smile in her eyes right there.
We have a small token of appreciation on
Thank
behalf of the
you.
class. Thank you so much for joining us today. You will share your contact information, or if it's okay for us to share your contact information. I imagine a few folks in here would like to follow up with you.
Yes.
Don't hesitate to benefit from the wisdom of our speakers, particularly their experience. Angel offered really sage advice about navigating your career path, but also about navigating community work. So make sure you follow up, build a bridge, and to continue to benefit from her insights as you begin to think about what your career path will look like. And thank you for sharing your story so personally with us today.
Thanks. And I'll say, guys, I had really great coaches and mentors, and I still have 1 million people on my phone a friend list when things come up that I don't know how to handle. So if you have any questions, if you want to come out and shadow any of our communities, or you want to learn more about the work that we're doing, it's not disingenuous when I say, please email me, call me, get in touch, because I'm a firm believer in helping others get to where they would like to go to as well.
So if you go to the South Carolina Hospital Association website, you can find Angel there and connect with her beyond today's lecture. So as she is packing up her belongings, and make sure you don't forget your flash drive. I will at least say that this is all of the formal activity that we have for lab today.